Psoriasis. Psoriasis is a chronic skin condition characterized by patches of red, scaly, and sometimes itchy skin. It affects about 2 to 3% of the world population and can appear at any age, although it is most commonly diagnosed between the ages of 15 and 35. The exact cause of psoriasis is not fully understood, but it is believed to be related to an overactive immune system. In people with psoriasis, the immune system mistakenly attacks healthy skin cells, causing them to reproduce too quickly. This leads to the buildup of skin cells on the surface, resulting in the characteristic red, scaly patches. What part of my body will psoriasis affect? A psoriasis rash can show up anywhere on your skin. Psoriasis is common on your elbows and knees, face and inside of your mouth, scalp, fingernails and toenails, genitals, lower back, palms and feet. In most people, psoriasis covers a small area of their skin. In severe cases, the plaques connect and cover a large area of your body. Psoriasis isn't contagious. You can't get psoriasis by coming into contact with another person's psoriasis skin rash. Types of psoriasis. There are different types of psoriasis. The type of psoriasis and its severity can vary from person to person. The more common types of psoriasis include: 1. Plaque psoriasis is the most common form of psoriasis. It is characterized by raised, red, scaly patches on the skin, known as plaques. These plaques can be itchy and painful, and are typically found on the elbows, knees, scalp, lower back, and face. Plaque psoriasis is a chronic condition that can come and go, with symptoms ranging from mild to severe. 2. Guttate psoriasis is a type of psoriasis that often starts in childhood or young adulthood. It is characterized by small, red, scaly spots or droplets on the skin, usually appearing suddenly, often following a streptococcal infection, such as strep throat. These spots are usually found on the trunk, limbs, and scalp, but can also appear on the face and other parts of the body. Unlike plaque psoriasis, guttate psoriasis is usually not as scaly and may clear up on its own within a few weeks or months. In some cases, however, guttate psoriasis can turn into a more persistent, chronic form of psoriasis, such as plaque psoriasis. Treatment for guttate psoriasis usually involves topical medications, such as corticosteroids or coal tar ointments. And in severe cases, oral medications or light therapy may be necessary. 3. Seborrheic psoriasis is a type of psoriasis that affects areas of the skin that are rich in oil glands, such as the scalp, face, and chest. It is characterized by red, scaly, and sometimes itchy patches of skin that may flake or peel. In severe cases, seborrheic psoriasis can cause significant scaling and crusting of the scalp, leading to hair loss. Seborrheic psoriasis is often mistaken for seborrheic dermatitis, a separate skin condition that is caused by overproduction of oil and yeast overgrowth on the skin. However, seborrheic psoriasis is a type of psoriasis, and is related to an overactive immune system. Treatment. Treatment for seborrheic psoriasis usually involves topical medications, such as corticosteroids, coal tar, or antifungal shampoos. In severe cases, light therapy or oral medications may be necessary. It is important to maintain good skin hygiene and avoid triggers, such as stress, alcohol, and smoking, which can worsen symptoms of seborrheic psoriasis. 4. Nail psoriasis is a form of psoriasis that affects the nails of the fingers and toes. It is characterized by changes in the appearance of the nails, such as thickening, yellowing, or pitting, and separation of the nail from the nail bed. In severe cases, nail psoriasis can cause the nails to become deformed and painful, making it difficult to perform daily activities. Nail psoriasis often occurs in conjunction with other forms of psoriasis, such as plaque psoriasis or guttate psoriasis, and can be difficult to treat. Topical medications and light therapy may provide some relief, but oral medications are often necessary to effectively treat nail psoriasis. In severe cases, surgery may be necessary to remove the affected nail and allow for regrowth of a healthy nail. It is important to seek treatment for nail psoriasis, as it can lead to functional limitations and cause significant psychological distress. A dermatologist or rheumatologist can provide an accurate diagnosis and develop a comprehensive treatment plan for nail psoriasis. Rare psoriasis types. The rare forms of psoriasis include 5. Pustular psoriasis is a rare and severe form of psoriasis that is characterized by the sudden appearance of small, raised, white blisters filled with pus on the skin. These blisters are surrounded by red, inflamed skin, and can be accompanied by fever, chills, and severe itching. Pustular psoriasis can occur on any part of the body, but most commonly affects the hands and feet. There are two main types of pustular psoriasis: generalized pustular psoriasis and localized pustular psoriasis. Generalized pustular psoriasis is a more severe form of the condition that affects large areas of the skin and can be life-threatening. Localized pustular psoriasis is a less severe form of the condition that affects only one area of the skin. Treatment for pustular psoriasis usually involves the use of systemic medications, such as oral or intravenous steroids, methotrexate, or biologic drugs. Light therapy may also be used in conjunction with other treatments. It is important to work closely with a healthcare provider, as pustular psoriasis can be a serious condition that requires careful management. In addition to medical treatment, lifestyle changes, such as stress management and avoiding triggers, such as certain medications or skin irritants, can help improve symptoms of pustular psoriasis. Maintaining good skin hygiene and avoiding tight clothing that can irritate the skin can also be helpful. 6. Inverse psoriasis, also known as intertriginous psoriasis, is a type of psoriasis that affects skin folds and areas of skin that rub against each other, such as the armpits, groin, and under the breasts. It is characterized by red, shiny, smooth patches of skin that are often sore and sensitive. Unlike other forms of psoriasis, inverse psoriasis is not scaly, but instead appears moist and inflamed. Inverse psoriasis. Inverse psoriasis is often aggravated by moisture and friction, making it a common problem in overweight individuals or those who engage in physical activities that cause skin-to-skin contact. It is also more common in individuals with other forms of psoriasis, such as plaque psoriasis. Treatment for inverse psoriasis usually involves the use of topical medications, such as corticosteroids or calcineurin inhibitors, and avoiding triggers, such as tight clothing or excessive sweating. In severe cases, systemic medications, such as oral or intravenous steroids, may be necessary. Maintaining good skin hygiene, such as keeping skin folds clean and dry, and avoiding irritants, such as harsh soaps, can also help improve symptoms of inverse psoriasis. It is important to seek treatment for inverse psoriasis, as it can be a painful and embarrassing condition that can significantly impact daily activities and quality of life. A dermatologist or rheumatologist can provide an accurate diagnosis and develop a comprehensive treatment plan for inverse psoriasis. 7. Erythrodermic psoriasis is a rare and severe form of psoriasis that is characterized by a widespread, fiery red rash that covers most of the skin. It is often accompanied by severe itching and pain, as well as an increased heart rate and body temperature. Erythrodermic psoriasis can cause the skin to become tight and uncomfortable, and can lead to severe dehydration and malnutrition if left untreated. Erythrodermic psoriasis is a serious medical condition that requires prompt treatment. It can occur suddenly, or as a result of a flare-up of another form of psoriasis, such as plaque psoriasis. Erythrodermic psoriasis can also be triggered by a skin infection, a reaction to medication, or severe sunburn. Treatment for erythrodermic psoriasis usually involves the use of systemic medications, such as oral or intravenous steroids, and inpatient hospitalization to manage fluid and electrolyte imbalances. Topical medications and light therapy may also be used in conjunction with other treatments. In addition to medical treatment, lifestyle changes, such as stress management and avoiding triggers, such as certain medications or skin irritants, can help improve symptoms of erythrodermic psoriasis. Maintaining good skin hygiene and avoiding tight clothing that can irritate the skin can also be helpful. It is important to seek immediate medical attention if you suspect you have erythrodermic psoriasis, as it can be a life-threatening condition. A dermatologist or rheumatologist can provide an accurate diagnosis and develop a comprehensive treatment plan for erythrodermic psoriasis. 8. Psoriatic arthritis is a type of arthritis that occurs in some people with psoriasis, a chronic skin condition. It is a form of inflammatory arthritis that affects joints and can cause pain, swelling, and stiffness. The exact cause of psoriatic arthritis is not known, but it is thought to be related to the underlying immune system dysfunction that causes psoriasis. In people with psoriatic arthritis, the immune system mistakenly attacks healthy joints and tissues, leading to inflammation and joint damage. The symptoms of psoriatic arthritis can vary from person to person and may include 1. Pain and swelling in joints, particularly in the fingers, toes, knees, ankles, and wrists. 2. Stiffness and pain in the lower back, hips, and neck. 3. Nail changes, such as thickening, discoloration, or separation from the nail bed. 4. Tenderness and pain in the soles of the feet. Diagnosis of psoriatic arthritis is typically made based on a combination of physical examination, medical history, and laboratory tests. X-rays and other imaging tests may also be used to assess joint damage. Treatment for psoriatic arthritis is aimed at reducing inflammation, slowing joint damage, and improving overall joint function and quality of life. Treatment options may include 1. Nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce pain and swelling. 2. Disease-modifying anti-rheumatic drugs, DMARDs, to slow joint damage and improve joint function. 3. Biologic drugs to target specific components of the immune system that contribute to inflammation. 4. Physical therapy and exercises to maintain joint mobility and flexibility. 5. Lifestyle changes, such as weight loss and stress management, to reduce joint stress and improve overall health. It is important to work closely with a doctor to develop an individualized treatment plan for psoriatic arthritis. That takes into account the specific needs and health status of each person. Early and aggressive treatment can help to slow joint damage and improve outcomes for people with psoriatic arthritis. What are the causative factors for psoriasis? The exact cause of psoriasis is not fully understood, but it is believed to be a combination of genetic, environmental, and immune system factors. Some of the known causes of psoriasis include 1. Genetics. Psoriasis has a strong hereditary component, meaning that it tends to run in families. People with a family history of psoriasis are more likely to develop the condition. 2. Immune system dysfunction. Psoriasis is caused by an overactive immune system that triggers inflammation in the skin. This leads to the rapid production of skin cells, which form the characteristic plaques and scales of psoriasis. 3. Environmental triggers. Certain triggers, such as stress, injury to the skin, infections, and certain medications, can cause a flare-up of psoriasis symptoms. Other environmental factors, such as cold weather, smoking, and alcohol consumption, may also worsen symptoms. 4. Obesity. People who are overweight or obese are more likely to develop psoriasis, and weight gain can also worsen existing symptoms. 5. Vitamin D deficiency. Vitamin D is important for skin health, and a deficiency may contribute to the development of psoriasis. 6. Stress. Stress can trigger or worsen psoriasis symptoms, and individuals with psoriasis are more likely to experience anxiety and depression. It is important to note that psoriasis is a complex condition and its causes can vary from person to person. A dermatologist can help identify the specific triggers and causative factors in each individual case, and develop a personalized treatment plan to manage symptoms. 7. Certain drugs can cause or worsen psoriasis. Medications. Some medications, such as beta blockers, lithium, antimalarials, and nonsteroidal anti-inflammatory drugs, NSAIDs, can trigger a flare-up of psoriasis symptoms or make existing symptoms worse. 8. Excess alcohol consumption can trigger a flare-up of psoriasis symptoms or make existing symptoms worse. Alcohol can also interfere with the effectiveness of psoriasis treatments and can cause dehydration, which can make symptoms worse. It is important to discuss any medication changes or alcohol consumption with the dermatologist, as they may need to adjust the treatment plan accordingly to minimize the impact on psoriasis symptoms. Additionally, individuals with psoriasis should avoid or limit their alcohol intake. as this can help improve symptoms and reduce the risk of flare-ups. Diagnosis of psoriasis is typically based on a combination of physical examination, medical history, and laboratory tests. The following tests are commonly used to diagnose psoriasis. 1. Physical examination. A dermatologist will examine the affected skin, looking for the characteristic symptoms of psoriasis, such as red, scaly plaques, or pustules. The dermatologist may also use a magnifying glass or dermatoscope to get a better look at the skin. 2. Medical history. The dermatologist will ask about any symptoms, previous skin conditions, family history of psoriasis, and any triggers that may have caused a flare-up of symptoms. 3. Skin biopsy. In some cases, a skin biopsy may be performed to confirm the diagnosis of psoriasis. A small sample of skin is removed and examined under a microscope to look for the characteristic changes associated with psoriasis. 4. Blood tests. Blood tests may be performed to rule out other conditions with similar symptoms, such as eczema or a fungal infection. Blood tests can also be used to check for any underlying medical conditions that may be contributing to the development of psoriasis. What is HLA antigen protein test? HLA, human leukocyte antigen test is a blood test used to determine if an individual has a genetic predisposition to develop certain autoimmune diseases, including psoriasis. The HLA system is a group of genes responsible for producing proteins that help the immune system distinguish between the body's own cells and foreign invaders, such as bacteria and viruses. People with psoriasis have a higher likelihood of having specific variations in the HLA genes, known as HLA-CW6 and HLA-B13, compared to those without the condition. The HLA antigen test is used to identify these genetic variations and can help confirm a diagnosis of psoriasis or identify individuals at increased risk of developing the condition. It is important to note that a positive result on an HLA antigen test does not guarantee that an individual will develop psoriasis. Many people with the HLA-CW6 and HLA-B13 variations never develop psoriasis, while others who do not have these variations may still develop the condition. The HLA antigen test is just one of several factors considered in the diagnosis of psoriasis. 5. Nail clippings or scrapings. If the nails are affected, a dermatologist may take a sample of nail clippings or scrapings for examination under a microscope. Diagnosis. A dermatologist will use the results of these tests, along with a physical examination and medical history, to make a definitive diagnosis of psoriasis. In some cases, additional tests or referral to a specialist may be necessary to confirm the diagnosis or to rule out other conditions. Treatment of psoriasis depends on the severity of the condition and the type of psoriasis. In mild cases, over-the-counter creams and ointments may be sufficient to control symptoms. For moderate to severe cases, a combination of topical treatments and medications taken orally or by injection may be necessary. Treatment options for psoriasis depend on several factors, including the severity of symptoms, the type of psoriasis, and the location of affected skin. Some common treatment options for psoriasis include topical treatments. Topical treatments are creams, ointments, and gels applied directly to the affected skin. These include corticosteroids, vitamin D derivatives, salicylic acid, and coal tar, which can help reduce redness, itching, and scaling. Topical treatments for psoriasis include corticosteroid creams, coal tar ointments, and calcipotriene ointments. These medications can help to reduce inflammation and slow the growth of skin cells. 1. Corticosteroids are a type of medication commonly used in the treatment of psoriasis. They work by reducing inflammation, which can help improve symptoms such as redness, itching, and scaling. Corticosteroids can be applied topically, taken orally, or administered by injection, depending on the severity of symptoms and the location of affected skin. Topical corticosteroids are available in creams, ointments, and gels and are applied directly to the affected skin. They come in a range of strengths, from mild to potent, and are used to treat mild to moderate psoriasis. The strength of the corticosteroid and the frequency of application will depend on the severity of symptoms and the location of affected skin. Oral corticosteroids are taken in pill form and are typically used for short periods of time to manage severe psoriasis flare-ups. Injectable corticosteroids are used to treat psoriasis in hard-to-reach areas, such as the scalp, and can provide rapid relief of symptoms. While corticosteroids are effective in treating psoriasis, they can cause side effects, particularly with long-term use. Side effects can include skin thinning, increased risk of infection, and changes in mood or behavior. It is important to use corticosteroids as directed by a doctor and to monitor for potential side effects. In addition, it is important to use corticosteroids in conjunction with other treatments, such as light therapy or topical creams, to help maintain control of symptoms and reduce the risk of side effects. 2. Vitamin D is a common treatment option for psoriasis, often used in conjunction with other treatments, such as topical creams or light therapy. Vitamin D works by slowing down the growth of skin cells, which can reduce the symptoms of psoriasis, such as redness, itching, and scaling. Topical forms of vitamin D, such as calcipotriol or calcitriol, are available in creams, ointments, and gels that are applied directly to the affected skin. They are commonly used to treat mild to moderate psoriasis and can be effective in reducing symptoms. Oral forms of vitamin D, such as calcitriol, are also available and are typically used for more severe cases of psoriasis. They work by controlling the growth of skin cells from the inside out, making them more effective for severe symptoms. Vitamin D. Vitamin D therapy can also be combined with other treatments, such as light therapy or corticosteroids, to help manage symptoms and reduce the risk of side effects. A dermatologist can help determine the best treatment plan for individual needs, including the appropriate use of vitamin D. While vitamin D is generally considered safe, it can cause side effects, such as itching or skin irritation, when used in large amounts or for prolonged periods of time. It is important to follow the recommended dosage and use only under the guidance of a doctor. Additionally, it is important to monitor vitamin D levels in the blood, as high levels can lead to other health problems. 3. Coal tar is a byproduct of coal processing and has been used for over a century as a treatment for psoriasis. It works by slowing down the growth of skin cells and reducing inflammation, which can help improve symptoms such as redness, itching, and scaling. Coal tar is available in over-the-counter shampoos, creams, and ointments, as well as prescription-strength formulations. It is applied directly to the affected skin and is commonly used to treat mild to moderate psoriasis. Coal tar is also used in combination with other treatments, such as light therapy or topical corticosteroids, to help manage symptoms and reduce the risk of side effects. A dermatologist can help determine the best treatment plan for individual needs, including the appropriate use of coal tar. While coal tar is generally considered safe, it can cause skin irritation, dryness, and staining of clothing or bedding. It can also increase sensitivity to sunlight, making it important to use sun protection when using coal tar products. In addition, coal tar is classified as a carcinogen by the International Agency for Research on Cancer, and long-term use or exposure can increase the risk of skin cancer. For these reasons, it is important to use coal tar products only under the guidance of a doctor and to monitor for potential side effects. Additionally, it is important to follow recommended dosages and use the product only as directed. 4. Dithronol is a topical medication that has been used for the treatment of psoriasis for over a century. It works by slowing down the growth of skin cells and reducing inflammation, which can help improve symptoms such as redness, itching, and scaling. Dithronol is available in a cream or ointment form and is applied directly to the affected skin. It is typically used for mild to moderate cases of psoriasis and can be an effective treatment for many patients. Dithronol therapy is usually done in a doctor's office or under medical supervision, as the medication can cause skin irritation and staining of clothing and bedding if not used correctly. The medication is usually applied to the affected skin for a specific time period, usually between 10 and 30 minutes, and then thoroughly washed off. In addition to its potential for skin irritation, dithronol can also increase sensitivity to sunlight, making it important to use sun protection when using the medication. Furthermore, long-term use of dithronol can increase the risk of skin cancer and other health problems. So it is important to use it only under the guidance of a doctor and to monitor for potential side effects. A dermatologist can help determine the best treatment plan for individual needs, including the appropriate use of dithronol. While it can be an effective treatment for some patients, it may not be appropriate for everyone. And alternative treatments, such as topical corticosteroids or light therapy, may be needed to manage symptoms. 5. There are several bath solutions available for psoriasis that can help soothe skin and improve symptoms such as itching, redness, and scaling. Bath solutions. Some common bath solutions include A. Dead sea salt. This type of salt contains minerals such as magnesium, calcium, and potassium that can help improve skin health. Adding a cup of Dead Sea salt to a warm bath can help soothe irritated skin and reduce symptoms of psoriasis. B. Epsom salt. Epsom salt contains magnesium, which can help reduce inflammation and improve skin health. Adding a cup of Epsom salt to a warm bath can help soothe itching and improve symptoms of psoriasis. C. Oatmeal bath. Colloidal oatmeal is a type of oatmeal that has been ground into a fine powder. Adding a cup of colloidal oatmeal to a warm bath can help soothe itching and improve symptoms of psoriasis by reducing inflammation and restoring skin moisture. D. Apple cider vinegar bath. Apple cider vinegar has anti-inflammatory properties and can help improve skin health. Adding a cup of apple cider vinegar to a warm bath can help reduce itching and improve symptoms of psoriasis. E. Herbal bath. Certain herbs, such as chamomile, calendula, and lavender, have anti-inflammatory and soothing properties that can help improve symptoms of psoriasis. Adding dried herbs to a warm bath can help soothe skin and improve symptoms. 6. It is important to note that while bath solutions can be helpful in managing symptoms of psoriasis, they should not be used as a substitute for other treatments recommended by a doctor. Additionally, soaking in warm water for long periods of time can dry out skin, so it is important to follow up with a moisturizer after a bath. 7. Coconut oil is a popular natural remedy for several skin conditions, including psoriasis. Some people with psoriasis have reported that applying coconut oil to their skin has helped soothe itching and reduce redness and scaling. Coconut oil is high in fatty acids, which can help improve skin health and hydration. However, it is important to note that there is limited scientific evidence to support the effectiveness of coconut oil for psoriasis. Additionally, some people with psoriasis may be allergic or sensitive to coconut oil, which can worsen their symptoms. It is recommended to consult with a doctor before using coconut oil as a treatment for psoriasis, as it may interact with other medications or treatments. The doctor can also advise on the appropriate amount and frequency of application, as well as the best type of coconut oil to use. In conclusion, while some people with psoriasis may find relief from using coconut oil, it is not a proven treatment and may not be effective or safe for everyone. It is best to discuss any treatment options with a doctor before using them. Drug treatment of psoriasis. There are several types of drugs used in the treatment of psoriasis, including topical medications. Topical medications, such as creams, ointments, gels, and lotions, are applied directly to the skin and are used to treat mild to moderate psoriasis. These medications include corticosteroids, calcineurin inhibitors, coal tar, salicylic acid, and vitamin D analogs. Systemic medications. Systemic medications are taken orally or by injection and are used to treat moderate to severe psoriasis. These medications include nonsteroidal anti-inflammatory drugs, NSAIDs, immunosuppressants, retinoids, and biologic drugs. Retinoids are a type of medication used in the treatment of psoriasis. They are derived from vitamin A and work by slowing down the production of skin cells. Retinoids. The following are the commonly used retinoids in the treatment of psoriasis. A. Acitretin. This is an oral retinoid that is used to treat severe cases of psoriasis. It works by reducing skin cell production and has been shown to be effective in treating psoriasis of the palms and soles, as well as severe psoriasis of the scalp and nails. B. Tazarotene. This is a topical retinoid that is used to treat mild to moderate psoriasis. It is applied directly to the skin and works by reducing skin cell production and slowing down the growth of new skin cells. C. Alloretinoid. This is an oral retinoid that is used to treat severe cases of psoriasis. It works by reducing skin cell production and has been shown to be effective in treating psoriasis of the palms and soles, as well as severe psoriasis of the scalp and nails. Retinoids are often used in combination with other medications, such as topical corticosteroids and phototherapy, to achieve the best results. However, it is important to note that retinoids can have potential side effects, such as dryness and scaling of the skin, and may not be suitable for everyone. It is important to discuss the risks and benefits of these medications with a doctor. Biologic drugs. Biologic drugs are medications that target specific proteins in the body that play a role in the development of psoriasis. These drugs are used to treat moderate to severe psoriasis and include tumor necrosis factor, TNF, inhibitors, interleukin, IL, inhibitors, and IL-17 inhibitors. Biologic drugs, such as etanercept, infliximab, and ustekinumab, are also sometimes used to treat moderate to severe psoriasis. These drugs target specific parts of the immune system that contribute to psoriasis. Traditional systemic medications, such as methotrexate and cyclosporin, are used to treat moderate to severe psoriasis. These medications work by suppressing the immune system to reduce skin cell production and inflammation. Cyclosporins are a type of medication used in the treatment of psoriasis. They are immunosuppressant drugs that work by suppressing the immune system, which helps to reduce the inflammation and skin cell production that is characteristic of psoriasis. Cyclosporins are typically used to treat severe cases of psoriasis, such as erythrodermic psoriasis, pustular psoriasis, and those that do not respond to other treatments. The most commonly used cyclosporin for the treatment of psoriasis is oral cyclosporin A. It is usually taken as a daily oral dose and is effective in treating severe cases of psoriasis within a few weeks of starting treatment. The dose of cyclosporin A is adjusted based on the severity of the psoriasis and the response to treatment. Cyclosporins are generally well tolerated, but they can have potential side effects, such as increased risk of infection, kidney damage, and high blood pressure. Therefore, it is important to monitor kidney function and blood pressure regularly while taking cyclosporins. The use of cyclosporins should be under close supervision of a doctor and should be limited to specific cases where they are necessary. It is important to note that cyclosporins should not be used as a first-line treatment for psoriasis. They are typically reserved for severe cases of psoriasis that do not respond to other treatments. Before starting treatment with cyclosporins, it is important to discuss the risks and benefits with a doctor and to consider alternative treatment options. The type of medication used will depend on the severity of psoriasis, the specific symptoms being treated, and the individual's response to therapy. It is important to discuss the risks and benefits of each type of medication with a doctor and to carefully follow the recommended guidelines for use. Side effects. It is also important to note that some medications can have potential side effects and may not be suitable for everyone. For example, traditional systemic medications can have serious side effects, including liver and kidney damage, and should be used with caution. Biologic drugs can also have side effects, such as increased risk of infections, and should be used only under the close supervision of a doctor. Phototherapy, also known as light therapy, is a treatment option for psoriasis. In severe cases of psoriasis, ultraviolet, UV, light therapy may be recommended. This involves exposing the affected skin to controlled doses of UV light in a doctor's office or special light box. There are several types of phototherapy, including UVB phototherapy. UVB phototherapy involves exposing the skin to a specific wavelength of UVB light, which helps to slow down the production of skin cells and reduce scaling, redness, and itching. This type of phototherapy is often administered in a doctor's office or at a phototherapy center. Narrowband UVB phototherapy. This type of UVB phototherapy uses a narrower range of UVB light, which is thought to be more effective and have fewer side effects than other forms of UVB phototherapy. Excimer laser therapy. Excimer laser therapy is a type of phototherapy that uses a laser to target specific areas of skin affected by psoriasis. The laser emits UVB light that penetrates the skin and helps to slow down the production of skin cells, reducing scaling and redness. Psoralen plus ultraviolet A, PUVA, phototherapy. PUVA phototherapy involves taking a photosensitizing medication, psoralen, before exposure to UVA light. The UVA light penetrates deeper into the skin and helps to slow down the production of skin cells, reducing scaling and redness. Phototherapy is typically administered 2 to 3 times per week, and the number of treatments required depends on the severity of psoriasis and the individual's response to therapy. Phototherapy is often used in combination with other treatments, such as topical medications or systemic medications, to achieve the best results. It is important to note that phototherapy can have potential side effects, including sunburn, premature aging of the skin, and increased risk of skin cancer. It is important to discuss the risks and benefits of phototherapy with a doctor, and to carefully follow the recommended guidelines for use. Combination therapy. Combination therapy involves using a combination of topical treatments and light therapy, or a combination of systemic medications and light therapy, to maximize the benefits of treatment and minimize the risk of side effects. Lifestyle changes. Making lifestyle changes, such as quitting smoking, reducing stress, and avoiding triggers, can help improve psoriasis symptoms and prevent flare-ups. Alternative treatments. Some people with psoriasis turn to alternative treatments, such as herbal supplements, acupuncture, and dietary changes, to help manage their symptoms. However, the efficacy of these treatments has not been fully established, and it is important to speak with a doctor before using alternative treatments, as some may interact with other medications or cause adverse effects. It is important to work with a dermatologist to develop a treatment plan that is tailored to individual needs, as the right combination of treatments can help manage psoriasis symptoms and improve quality of life. In some cases, treatment may need to be adjusted as symptoms change or as the condition progresses. Lifestyle changes, such as maintaining a healthy diet, reducing stress, and avoiding triggers, such as alcohol and smoking, can also help to control symptoms of psoriasis. In conclusion, psoriasis is a chronic skin condition that affects 2 to 3% of the world population. The exact cause is not fully understood, but it is believed to be related to an overactive immune system. There are several different types of psoriasis, and treatment depends on the severity of the condition and the type of psoriasis. Topical treatments, oral medications, and UV light therapy are common treatments for psoriasis, and lifestyle changes can also help to control symptoms.